Chapter 10, Treatment of Cognitive Disorders. In this chapter, we will go to have an overview of cognitive disorders and mainly focusing like on dementia and Alzheimer's and the medication that is used to treat the symptoms. When we're looking at a cognitive disorder such as dementia, pretty much so the medications that are out there cannot cure it. If anything, it just retards the symptoms or the progression of this disorder, of this illness. So it's slowing it down, but based on the client's symptoms, that's going to play a part in what kind of medication is provided. So if we're looking at maintaining mental functioning, we're looking at cholinesterase inhibitors, so like a donepezil, and pretty much the cholinesterase inhibitors will help stop acetylcholine from breaking down, and we know that acetylcholine plays a part in mental functioning. Memantine, which is also, and that's also the brand name, can also treat symptoms when we're talking about maintaining mental functioning. When we're looking at controlling behavior or mood, so if the client who has dementia or a progressive form of which would be Alzheimer's, we might be looking at, they could be experiencing depression or just agitation. And with that, we would either treat if it's more of an agitation, perhaps even aggressive behaviors. We may be looking at using antipsychotics like a Zyprexa or a Risperdal. Whereas if there's depressive symptoms, we could be using an antidepressant. So once again, it's just keeping in mind with this disorder that it's more so treating the symptoms, but looking at it from more a physiological stance. I mean, we also look at the behavior because, of course, mood and behavior. But unlike if we're looking at anxiety, we're kind of looking at, of course, treating, those symptoms, but also looking at more of a holistic approach. But because this disorder really it has to do with the deterioration of the brain, what we're just looking at is trying to slow it down to the best of our ability. So a pharmacological approach, of course, is going to be the very first step in treating this. If we're looking at the client that might have had strokes or high blood pressure, we of course suggest, or the doctor might put them on a high blood pressure or a high cholesterol medication, especially for conditions that might be at risk for a vascular dementia, so that these drugs may prevent future strokes, heart disease that can lead to further brain damage. So if there's a concern with that, then of course, especially with vascular dementia, then they might be prescribed a high blood pressure medication or a high cholesterol medication. So a beta blocker, a Lipitor, just depending. Alternative medication that can be used, we're looking at ginkgo biloba. Although research is not that concrete on if it works or not, some believe that it can preserve memories. Also, non-steroid anti-inflammatory drugs have been looked at. And just like with ginkgo biloba, where the research is inconclusive, some scientists do believe that the NSAIDs had an effect on the inflammation in the brain of individuals who might have had or who have had progressive forms of dementia and Alzheimer's. So in reducing the inflammation in the brain. Antioxidants and vitamin E supplements have also been suggested as alternative meds, but once again, inconclusive evidence on how effective they are in slowing down the process of dementia. Now, if we have a client who has this disorder, of course, we are going to look at some of the symptoms and create a treatment plan based on that. So if they're having memory issues, well, of course, that's one of the main symptoms, but depending on how far they are into it, how progressive it is, we might just be looking at if it's just basic small memory issues, strategies so that they can remember things, such as putting post-its in different places. Sometimes doing family therapy to help them understand the disorder is also important. So just like with all of the disorders, what's very important is to look at the symptoms so that we can find an appropriate treatment plan in conjunction with pharmacological therapy.